Good afternoon, and thank you for joining us. Yesterday, our Board of Supervisors met and had a lengthy and intense discussion on where we stand with this ongoing pandemic and where we're going to go. We wanted to listen to a variety of voices, so we had a panel that included former San Diego Mayor Jerry Sanders, who is President and CEO of the San Diego Regional Chamber of Commerce, and talked to us about the pandemic's impact on small business. In addition, we heard from Ray Major, the chief economist from the San Diego Association of Governments, who spoke about the wider economic impact to our region. In addition, we heard from Demetrius Alexio, the president and CEO of the Hospital Association of San Diego and Imperial Counties, and from San Diego County Office of Education Superintendent Dr. Paul Gotthold. And of course, we heard from you. We heard from nearly 60 speakers who shared their experiences, opinions, and their stories of coping with the fallout from this pandemic. I want to thank all of the panel speakers who made their presentations, and I certainly want to thank you again to all of the speakers who called in yesterday. We know the decisions of the Board of Supervisors are not going to please everyone, but we did hear and we are working to address all the concerns and needs that were expressed. The reality is that we are at a critical juncture in our battle against this pandemic. Over the past 6 months, we have done a great job in limiting the spread of the virus, and that has allowed us to slowly and carefully reopen businesses and segments of our society. But as we've reopened, we've seen cases rise again. And now we are at the risk of going backward into more restrictions as mandated by the state's new color-coded tier system for reopenings. It's a very fine balance between continuing to safeguard the public health with reopenings, while at the same time walking that tightrope, trying not to lean too far one way or the other. And walking that tightrope demands small, careful steps, not reckless leaps forward. That's why yesterday our Board of Supervisors voted unanimously to approve several recommendations regarding funding for programs aimed at stopping the pandemic, including money for schools and for more testing. The board also voted unanimously to request from the state that the criteria it uses to monitor cases not counted include numbers from San Diego State University and other colleges where students are more easily contained and monitored in a campus environment. We believe that will make a big difference and give us a fighting chance to avoid further restrictions. Unfortunately, so far, the state is not receptive to our requests, but we're going to continue to push for consideration of reasonable alternatives to prevent our businesses from having to close simply because there are a number of outbreaks that have nothing to do with business operations. As a result, I've scheduled a special closed session tomorrow afternoon to consider our options. There was good news in the middle of these hard discussions yesterday. Our board voted unanimously to approve a series of economic stimulus grants to help small businesses throughout the region that have been harmed by the pandemic. We voted to approve over $14.5 million in grants to more than 2,000 individual businesses. Individually, these investments by the county may seem small, but for businesses struggling to survive, they can make all the difference in the world. With that, we're going to move on with our updates today, and we are joined again by special guests from San Diego State University who will answer questions that may come up about COVID cases and testing at the SDSU campus. The individuals are the same ones we had with us last week. We're honored to have with us Dr. Andrea Dooley, who's the Associate Vice President for Health, Welfare, Being, and Accessibility, and also Dr. Luke Wood, Vice President for Student Affairs and Campus Diversity. And now, please welcome my colleague, Supervisor Nathan Fletcher.
Thank you, Chairman Cox, and good afternoon. While we have a significant focus on our case count, what tier it puts us in, and what the future may hold, and a robust discussion about the role of San Diego State in those cases. I think it's important for all of us to be reminded that even in the numbers being reported now, 3/4 of the cases are not associated with San Diego State at all, which is a reminder to all of us in the community that the actions we take have a significant impact on our overall case count. It's a reminder to us all the need to continue to utilize face coverings, physical distancing, avoiding large indoor settings, hand washing, all the things that several times we have done to successfully slow the spread and lower our case count. The 1/4 of cases associated with San Diego State, they are going to great lengths to try and contain the spread, limit the spread, and get that under control. And we know as a region that what we have to do, regardless of where we land or what happens, is come together to slow the spread. And so we continue to urge that vigilance, that continued daily action. We've been at this for a while, and it's natural that a fatigue can set in, but coronavirus does not get tired. It does not fatigue. And so we have to continue to summon the daily strength, as difficult as it is, as hard as it is, as challenging as the economic situation is, as challenging as the education situation is, the challenges our healthcare system face. We have to all continue to plow ahead, continue to be vigilant, and continue to work. This will not go away on its own. And so we have to find that same strength that we found early in the year where we came together and saw significant progress at the outset of this. The same spirit we summoned in July when we had a case count that collectively we came together and we brought down significantly. We have to continue to have that same focus and attention as we move through these difficult and challenging times. With that, let's jump into our updates for today. We're going to start with the testing result time. Again, you see significant progress has been made here and continues to be made. It is vitally important we have fast turnaround of our testing results, which is what enables our case investigation and contact tracing systems to be effective. There you see hospitals between 1 and 1.5 days, our public health labs, our county Helix partnership, which is moving at about the same speed as our hospital rates are. The state walk-in testing, that is a significant improvement from where we were several weeks ago. And commercial labs are doing better, still not ideally where we would like them to be, but the bulk of the testing, again, coming in that 1 to 2 day range. If we move to the next chart, you'll now see our seven-day average of test report, 7,838, percentage of positive right there. Total tests reported for our region, 944,469. Those are tests reported to date, so we are closing in on that 1 million mark. Case investigations, really solid, 98%. Case close contacts, 95%, and total case investigations performed there now approaching 50,000, and the treatment numbers on the right. For today's results and numbers, you'll see we're looking at 264 positive tests today. Out of the increased number of testing, 8,644, which puts us at a 3% percentage of positive for today. And then the purple line there, of course, representing our 14-day rolling average, which is now sitting at 4.4%. Our COVID hospital census, you see our ICU beds staying relatively stable, where we've been right there in the mid to high 90s, where we've been pretty consistent for about the last month. Non-ICUs above that for the total hospitalizations, again, holding relatively stable there at 278. Next chart will be our total hospital census. You'll take the 278 that are COVID on the bottom, and the rest of them there, you'll see 4,229, again, holding stable and flat. And then the same is true for ICU bed census. Both our COVID ICUs there at the bottom, our non-COVID at 66%. Again, we've hovered in that mid to upper 60s range pretty consistently for about the course of the last month. That concludes my update. I'll now turn it over to Dr. Wooten for her public health officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. As of today, there have been almost 29.7 million COVID-19 cases that have been confirmed worldwide, and over 6.7 million in the United States. That includes almost 200,000 deaths. Today's local case count is 43,445 cases, which is 264 more cases than yesterday, a decrease in the new cases since yesterday's report of 294 cases. This overall total number of cases includes 748 deaths, with 6 new deaths reported since yesterday. In the next slide, the age range for overall cases remains the same, 3 months of age to 102 years of age. The distribution is at 58% for the age groups 20 to 49 years of age, and the demographics for gender remains the same. 51% of the cases are female and 49% are male. 3,349, or 8% of the cases, have been hospitalized. 787 of those hospitalized have been admitted to the ICU, and the total number of cases includes 748 total deaths, and this represents 1.7% of the total number of cases. In this next slide, this reviews demographics related to hospitalized cases. The majority of the total number of hospitalized cases is 50 years of age and older, and this is represented by 72%, 2,400 of the cases. Males represent the majority of hospitalizations at 1,815, or 54%, and Hispanics or Latinos represent the majority of hospitalizations at 1,935 cases, or 62%. The next slide speaks to further demographics related to deaths. 327, or 44% of all deaths were female, 421, or 56% were male. 717, or 96% of the total number of deaths all had underlying medical conditions, leaving 31, or 4% of the total number of deaths with no underlying medical conditions. And as always, we want to extend our sincerest sympathies and condolences to the families and friends of those individuals that have lost their lives to COVID-19. I would also like to remind everyone that all of our statistics shared here today and much more can be found on the county's coronavirus website at www.coronavirus-sd.com. Now, on this next slide, it shows our triggers dashboard, where there are 2 metrics that have not met or that have exceeded the threshold. These 2 include case rate and community outbreaks. As everyone knows, under the Blueprint for a Safer Economy, the metrics framework includes case rates and testing positivity. This tier framework lays out the metrics and thresholds that each county in the state of California must meet in order to open more sectors and parts of the economy, and shows tiers based on risk of community disease transmission, if you will go to the next slide, which includes widespread, substantial, moderate, and minimal. As of yesterday, September 15th, while San Diego is still in Tier 2, or the red tier, our unadjusted rate for the 7-day period from Monday, September 7th to Sunday, September 13th is 7.9, and would place the county in the purple tier. Hence, the county has had 1 week of data related to Tier 1. If we continue to have a case rate above 7 for a second week, we do run the risk of moving to Tier 1 or the purple tier. The next scheduled state assessment to reveal the metrics numbers for all of the counties in California will be next Tuesday, September 22nd. And for more information related to the Blueprint for a Safer Economy, please visit covid19.ca.gov. Now, the other abnormal trigger metric for San Diego is community settings outbreaks. And if you will go to thank you. This slide shows all 281 active and inactive community setting outbreaks since March 25th by month, which accounts for 2,049 or 5% of the total COVID-19 cases. Keep in mind that currently only 72 of the 281 community outbreaks are still active. In the next slide, as you can see, the outbreak trends the outbreak trend shows increase of outbreaks beginning. You can go back one. Thank you. Beginning in July. Note that July has the largest number of outbreaks at 93, representing 549 cases. August, 85 outbreaks, representing 505 cases. And for the month of September, it is just ahead of what we saw for the month of June, with 42 outbreaks and 300 cases. Now in the next slide, this shows all 281 outbreaks since March 25th, and the top 3 settings of all of the 281 community outbreaks includes 67 outbreaks in restaurants/bars, plus 21 in restaurants only, for a total of 88 outbreaks, and then 80 in various businesses on the far left of the slide, and then in the middle, 22 in healthcare settings. And today, in the next slide, we are reporting 17 total community outbreaks for the past 7 days, September 9th to September 15th, which represents 103 cases. Today, 5 new community outbreaks were added to our list, and this includes 2 businesses, 1 faith-based organization, 1 grocery, and 1 private residence. In closing, we all must do our part to help decrease the spread of COVID-19, and these are the best practices that are recommended for everyone, no matter where you are, whether you are an individual or business or other settings. Practice great hand washing, hygiene, and sanitation. Stay 6 feet apart from others. Individuals should wear a facial covering when they leave their home, particularly within 6 feet of others. Avoid crowded places and stay home if you're sick. Now please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the questions.
Matt Hoffman, KPBS.
Hi, I know you guys call SDSU a community within a community for your reasoning and asking the state to discount SDSU students who have tested positive, but the school says that 75% of the cases are from students who are living off campus. So that means people are testing positive, using services, running errands, and getting food away from the campus. And we also know that a lot of SDSU students live around the county. So what area of the county are all these off-campus cases from, and how do you square still asking those to be discounted?
Well, I think the answer is the cases that aren't confined to SDSU are throughout the county of San Diego. But we have prepared a letter that I'm signing this afternoon to the governor, asking them to seriously consider discounting or not including the approximately 700 cases that we have right now from SDSU students. Of those 700 students, I think there's only been 1 that has been hospitalized, and that was only for a brief period of time and has been released. But maybe I could ask Dr. McDonald if he would like to come up and really focus on that as a very unique situation that should not be entered into the overall total numbers.
Thank you, Chairman Cox. Although about a quarter of the students are actually living in on-campus housing, the outbreak and the cases are associated with undergraduates that are living in the close proximity of the university, almost all primarily in the 92115 zip code, actually within blocks of the university. So even though they aren't technically on campus, they are peri-campus, and really that is a community that we are addressing our non-pharmacologic interventions or our messaging to control social distancing behaviors. Again, we've been working together with San Diego State to make sure that those who live physically on campus and those who live in the fraternities and sororities and those who live in apartment buildings and houses in the area around the campus are all getting the same consistent messaging about what to do to control this COVID in their population.
And I know you all say that these cases have nothing to do with business operations, but isn't it fair to assume that business operations are going to be impacted if 75% of the cases are off campus? These students, I assume, are going to grocery stores near campus, going to get food near campus. I mean, do we know that the virus has spread to like businesses or people shopping in nearby grocery stores around campus? Or
well, again, we know that the cases we've been describing in the San Diego State undergraduate population is very well described. We have very few cases that we can link to that population. It's at this point less than 10 that we're aware of that can be linked to any interaction with any San Diego State students. And the San Diego State students are doing what everyone else should be doing, or they should be doing what everybody else is doing, which is when they go out and are interacting in public, they should be wearing a mask, they should be social distancing, they should be washing their hands. Those students who are in isolation and in quarantine are in isolation and quarantine. So the other students are not in those categories, and they are getting the same messaging that I'm giving to the general public in San Diego, which is that it's important to all those components to limit spread of the virus.
thank you.
Okay, next question.
Brandon Lewis, CBS News 8.
Yes, I have two questions. My first is about a CDC study that found adults who test positive are twice as likely to report that they've dined at a restaurant. Is San Diego seeing a similar trend?
Okay, Dr. Wooten is shaking her head no. Okay, Dr. McDonald's going to respond in more detail.
Yeah, I can address that question. I've seen that same CDC study, and again, I think it's important to remember that correlation is not causation. That is, the measurement of people who are going out to dinner at restaurants might mean that they're doing other things that aren't being measured, and I think that that's commented upon in the CDC study. Those, again, who might be more socially active in one way might be socially active in another way. We have not done that kind of study here in San Diego, but it stands to reason that there may be people who are interacting more socially, and it's important that they follow the guidance that our public health officer has given, which is wearing a mask, socially distancing, and washing hands. And then when you do go out to restaurants, and I have gone out to restaurants in my neighborhood, take the precautions that the owners of the restaurant are providing when they are having you dine in their facility, and that you, as a responsible diner there, are in fact wearing your mask when you should, and following the protocols that have been laid out. So again, we have not specifically replicated that study here, but again, it stands to reason that anyone who's going out in public should be taking the precautions that we've been encouraging.
Thank you. And my second question is, given that there's a 7-day lag in gathering the data to determine our case rate, is our fate already sealed, or is there something the community can do between now and then to help get our case rate down by next Monday? And how long might businesses have to comply if we do enter Tier 1?
Okay, let me ask if Dr. McDonald or Dr. Wooten, or maybe both of them would want to respond.
No, I'm definitely not a person who likes to think of this, our fate is sealed type of attitude, to be honest with you. I think that what we should be doing is looking at our behavior today and what we should do moving forward. And it's actually, as Supervisor Fletcher pointed out nicely in the introduction, it's the same messages that we've been giving. If we do those things in a very rigorous and conscientious way, that will reduce the spread of the virus in the community. So again, I think it's important to know that the actions we take today do have an effect today for the spread and will have an effect in the future.
Okay, we'll go to the next question.
Andrea Lopez Villafana, San Diego Union Tribune.
Hi, Hi, good afternoon. I have two questions. The first one, you just mentioned the cases in off-campus housing, and just wondering how the university is keeping residents informed about COVID cases among the student population on and off campus.
Okay, as I mentioned, we do have a couple of representatives from San Diego State College that are here. I'm going to call up Dr. Andrea Dooley, who's the Associate Vice President for Health, Wellbeing, and Accessibility, to respond to that question.
Hi, thank you for your question. So in terms of our communication strategy with our students, we've used a variety of methods, including email. We do have a weekly digest that goes out to our students that provides information about the specific number of cases that we have, and then we're also working through our student leaders and other influencers within the student body in order to help push out that information. Thank you.
And sorry, how is that information being passed down to residents in the area?
San Diego State student residents or residents more generally in San Diego, in the local San Diego State community?
In the local San Diego State community, yeah, residents in general.
Yeah, so we have a website which indicates our numbers related to our cases. We have a communication protocol for our cases as it relates to our student counts or any counts affiliated with San Diego State. That weekly digest I mentioned, if you go onto the San Diego State COVID website, any member of the community or anywhere else can sign up for that digest so that they can get information that way as well. It provides a lot of information in addition to our counts, and then we've been working collaboratively with the county to report our numbers as well.
Thank you. And last,
sorry, I had one other thing just to add. We do partner closely through our government and community relations to work with the local community council as well.
and I actually spoke with someone from the community council, and they mentioned that there's a website where residents can report off-campus parties. Can you tell me how many reports the university has received since it allowed students back, and if there's some kind of discipline or follow-up that happens with those reports?
Yeah, I'm going to let our Dr. Luke Wood come up and answer the latter part of your question. But again, our main source for information at the university is our SDSU COVID website. And on there is a number of reporting forms. One of them is if any of our community members have been exposed or test positive. But another one of those reports is where community members, whether they're students, faculty, staff, other folks, can report those directly to the university as well.
And I can just respond to the total number of reports. So we have reports that come in from various places, but members from the local community. And then we vet those reports to determine which ones are accurate violations versus which ones might be misunderstandings. And we have about 70 reports that we have followed up on based upon that process. So as Andrea already mentioned, we work very closely with the community through our government relations person, Rachel Gregg. She's been fielding phone calls from members of the community, and then we respond to those, and then we do the follow-up that we've talked about previously. Thank you.
Okay, we have one final call in.
Paul Sisson, San Diego Union Tribune.
Thank you. What is the pace of the outbreak at SDSU? Is the rate of new cases at the university increasing, decreasing, or is it holding steady? We don't really have case-by-day breakdown, so it's hard to really understand from the daily numbers that appear on the SDSU website.
All right, Dr. McDonald is going to respond.
Yeah, thanks for that question, Paul. I don't know if we mentioned in the numbers today, but of the 264 cases that were announced today, 37 of those were confirmed cases from San Diego State University. And in addition to those 37 confirmed cases, we have 9 additional probable cases that we identified in the last 24 hours. So the total number of cases at San Diego State, which I think they'll be posting on their website a little bit after this, will be 722. So 37 confirmed, more than yesterday, and 9 more probables. I would say that when we're looking at the illness onsets of the students that we're seeing from San Diego State, we are seeing fewer in the last week compared to the first week of September. We are doing some more extensive testing with our colleagues at San Diego State, doing testing of students that live on campus and also encouraging those who are off campus to continue to get tested. We expect to find some more milder cases in that group, but certainly anecdotally the number of students that are coming in with acute illness is been recently decreasing.
Doctor, to follow up, how many of the SDSU students have been, that have tested positive have been asymptomatic so far? And what role do you think asymptomatic carriers are playing in this outbreak?
That's a great question. The second part first, I don't know exactly. As is true with other outbreaks in this type of population, we expect that asymptomatic transmission is probably contributing somewhat. The last time I looked at this was was last week, and about 11% of the students were individuals who reported no symptoms. That is, so 89% actually had symptoms. We would expect, as some time goes by, to pick up a few less symptomatic patients, but exactly how many, it's hard to say. We know from similarly aged groups of individuals, notably outbreaks that the Navy has seen, for example, that they have found a fairly substantial number of asymptomatic cases. Whether that's contributing to the outbreak or not, or whether those, again, are incidentally found when you have a wider net to catch patients or individuals by testing them, it's unclear, but we're doing as much as we can to be sure that we know who does and does not have SARS-CoV-2 in this patient population.
Doctor, I want to go back to a statement you had a little earlier in terms of the number of cases detected that have, I guess you could say, spilled over from the SDSU student outbreak into the general community. I think you said less than 10, is that correct?
That's correct. We are aware of at least 3 county residents who have direct connections with either individuals or residences associated with San Diego State that are not San Diego State students, also not faculty or staff at San Diego State who are epidemiologically linked to students. So I would say that those are ones we know about. And then we are aware of at least 4 cases of a non-county residents, that is individuals who don't live in our county who have connections with San Diego State students in the same manner. So if you add that up, it's less than 10. I was looking at that specifically yesterday, and that was accurate as of about 6 o'clock yesterday.
And then one final question. Does the county have any ability to order universities to shut down if outbreaks don't get under control?
Well, the Cal State system is a state organization, and we would work closely with the leadership of that university and the state to make that kind of a move. Again, that's perhaps something better, Dr. Wooten, to answer, but certainly we would work with all the cognizant authorities to take that kind of a move.
So you're saying that could be done, or you're saying that we should talk to somebody else about it?
I'm saying I'm not the legal expert on this.
You're an attorney, obviously.
Yeah.
Okay, that completes our call-in questions. We'll go now to the texted questions.
And this first question is from Chrissy Russo with Fox 5. Of the public and private K-12 schools that have opened their classrooms this fall semester, how many have reported positive COVID cases or outbreaks to the county? And how many of those schools then made changes to either go back to teaching online or some other hybrid schedule?
Okay, Dr. Wooten's going to respond to that question.
Thank you for that question. So to date, we are not aware of any outbreaks in any of the K through 12 schools. Hence, none of those schools would be required to close as a result. COVID-19 is widespread throughout the county, throughout the state. Single individuals can become infected, and some of those individuals might be staff at schools. But as stated earlier, just as we've done with those that have been diagnosed and positive at SDSU and across the county, when people are positive, they are isolated and their close contacts are quarantined. That's the whole purpose of that process, to remove them from the public so that they do not spread the virus to others. So at this point, we do not have any outbreaks in K through 12.
Okay, this next question, Dr. Wooten, is from Jane Morton with CBS 8. We saw large crowds lining up outside bars to watch football last Sunday. Now that football and baseball season is underway, how much of a concern is there over football parties at homes or fans going to their favorite sports bars to watch the games?
Well, there is always a concern about gatherings. That's why the state will be issuing guidance related to gatherings, hopefully in the very, very near future. But of course we are concerned. That is how COVID-19 is spread, by people gathering. Those individuals that might be asymptomatic and not have any symptoms, but can still spread the virus to others that they come in contact with. So as we stated earlier, everyone has a role to play. Those strategies that we share with you every day, but also people have a role to play in helping to report situations that we know shouldn't be occurring. So we have our compliance team, and there's a website where you can report situations that should not be occurring. Thank you.
Dr. Wooten, this next question is from Shalina Shadlani with KPBS. It's evident that there are outbreaks at many businesses, including nightlife hotspots, but the county says businesses are not the problem and is asking the state for relief from regulations. With so many outbreaks and case increases on and off college campuses, why do you think San Diego should be given preferential treatment, and why should we have more regulation to stop the spread?
Well, I think a response to that has been shared already. We're not asking for preferential treatment, but we're asking for consideration of the situation. If we look at the outbreaks, and actually on one of the slides where I showed you the outbreaks by month, we are seeing a decrease in the number of outbreaks, and we're halfway through September, and we are at 42. Now, given if we have 42 more through the rest of the remaining part of September, we could be very similar to August. But again, as Dr. McDonald stated earlier, as I stated in my opening comments, everyone has a role to play. And if everyone, when they go out, wear their facial coverings, stay 6 feet apart if you're not a household member, not going out to bars or gatherings, then we can really get our arms around this and help to continue to flatten the curve or decrease the spread of COVID-19. And that's what we need to happen, particularly in the next week, and certainly in the weeks to come.
Dr. Wooten, this next set of questions is from Claudia with Univision, and there's a couple of questions, so I'll go one at a time. The first question is, with the governor stating that the county cannot exclude positive cases from SDSU, where are we now? And if we fall to another tier, what kind of closures can we expect and when?
So I actually went through that yesterday during the board meeting. It might be an additional slide, but basically if you go to the website that I gave to you earlier, covid19.ca.gov, it shows what can open under tier 1, which is the purple tier, and what can open under tier 2, which is the red tier. So we would go, if it ends up that we have 2 weeks of purple or tier 1 data, then the left side would be the businesses that could be open. The right side is the businesses that are currently open under the red tier. But again, you know, we're not counting anything out yet until we continue to analyze the data, and through the data that's going to be analyzed for next week, we will look at that data then and know where we will be.
Thank you, Dr. Wooten.
This next question deals with testing at SDSU, and Dr. Wood's going to respond to that question.
And this is still from Claudia with Univision. Why is SDSU only requiring students living on campus to get tested and not students living off campus, since 75% of the positive cases are from students living off campus? Do you expect a spike in cases now that all dorm students are getting tested?
So part of this is really just jurisdictional issues. So as you might expect, we have jurisdiction over the land that we own, and that's the land that SDSU resides on. In our neighboring community, you know, as part of being good neighbors, we have stepped up a number of different efforts in terms of patrols through private security, messaging that we're doing with students. But all of those efforts, it's important to know that while we have jurisdiction over certain types of actions and behaviors, as it relates to testing, that is not one of the things that is within our jurisdiction. So as a result, what we do is we work closely with our partners, with the county, and in consultation with our system to do our best to ensure that we're having widespread participation. Thank you.
This next question deals with the number of outbreaks, and I'm going to ask Dr. McDonald if he would come up and respond.
This one is from Elliot with the AP. Can you update us on the number of outbreaks linked to SDSU and where they are and what types of settings?
We have, at this point, I believe, 4 residential outbreaks that are related to San Diego State students that are in the area around San Diego State. We are treating each one of those as specifically as a specific outbreak because we're working with the individuals that live in those residences and the management in those buildings to be able to make sure that all the infection control measures are being taken. We don't have any other outbreaks in other settings, such as restaurants or other businesses that are associated with the San Diego State students.
Thank you, Dr. McDonald.
We have one final question from Mike McKinnon.
And this one is with KUSI. There has only been one hospitalization of SDSU student affected with COVID-19, but the hospitalization rate among other people infected across the county is also low. Do you think the low hospitalization rate is enough reason to not move backwards in the reopening process if the state orders it?
Well, I think that was a major part of the discussion we had yesterday, and which precipitated really the letter that is being sent to the governor to ask for consideration and not including those cases from SDSU or other campuses as they reopen. The reality is that the number of cases in ICU and hospitalizations is not being impacted because of those cases from SDSU. That was one of the big criterias, one of the big focuses when we got started with this pandemic, was to make sure we don't adversely impact the ability of our hospitals in this region to respond to rising numbers. Well, that's clearly not the case at this point. We think there's justification for not including those numbers for SDSU and frankly other campuses in San Diego as they reopen. It was the state of California that basically gave the green light to reopen universities, and we don't think it's right to have those numbers included with the balance of the cases that we're seeing in this region. So we have not been successful at this point. Obviously the governor and Dr. Galley had made some reference to the request from San Diego in their press conferences today, but we are going to press on. I know that our Chief Administrative Officer, Dr. Helen Robbins-Myers, she's not a doctor, but could be, is on a special task force to work with the governor to see if we can't convince the governor and Dr. Galley that there's justification for this, not only for San Diego, but the other large urban counties. Keep in mind, San Diego County was the first county to come off of the purple list to red, and we think that there's other counties, particularly in Southern California, that are dealing with these same issues. So it's much larger than just San Diego County, and we hope to be successful in convincing the folks up in Sacramento that there is justification. That concludes our questions for today. We are not scheduled for further briefings this week. However, there is a special meeting of the Board of Supervisors next Tuesday at 3 p.m., which will be a public meeting. There's going to be a closed session of the Board of Supervisors tomorrow at 5 p.m. We will obviously report out if there's anything to report out. We'll be back here next week on Wednesday at 2:30. Until then, please stay safe, San Diego, and make sure to continue to wear those face masks. Thank you.